Welcome to Enhancing Clinical Practice and Outcome stream at SNOMED CT Expo 2025. Thank you to FAST for sponsoring this stream. My name is Sonja Ulrich. I'm the Software Development Manager at SNOMED International, and I'll be your moderator for today's session. We'll address all questions at the end of the presentation. For our online attendants, please use the Q&A button to submit your questions to the presenter. And for those attending in person, feel free to use the microphone provided here in the room when the time comes. It's now my pleasure to introduce Marije van Melle from NICTIS, who will be presenting national implementation of SNOMED CT for diagnosis and procedures in 6 Dutch healthcare sectors. Marije, over to you.
Yes, thank you so much, and thank you for the introduction. And everyone here, thank you all for being here. Welcome. After such a busy week, of course, on the last day, so I'm really happy that you're all here. And so I'm going to tell you something about our national implementation of SNOMED, which we approach by an implementation in 6 healthcare sectors. Well, that's already done. Just a quick overview of the Netherlands. I don't know, not everyone here maybe might know the Netherlands. We're a small country. And well, our healthcare system is divided in 4 main parts, which you also see in our legislation. And our healthcare system is a demand-driven system with healthcare insurances that drive well the healthcare that we do. This is something I wanted to let you know, because it also helps you understand the challenges that we see when implementing SNOMED in all these different sectors. Well, we do have electronic healthcare records, of course, in our healthcare system, although it is a fragmented system. In 2010 and 11, we tried to get a national healthcare record, which was almost approved, but bounced at the last, approval in Parliament. So then the responsibility was laid with the fields, and the fields in the Netherlands is very innovative, very technical. However, they all, implement things differently. So you see a lot of differences in healthcare records across the sectors. And we also still have a lot of free text and local codes. Well, to improve that, we have some new legislation and a strategy within the Netherlands. We have a legislation about healthcare exchange, that it should be digital. Also, all the sectors, they signed an agreement in which they are saying, okay, we're going to work towards this interoperability that we need in our country. And we also have a national vision and strategy on digital health. To get to interoperability and data availability in 10 years in 2035. However, the EHDS, of course, is a very big thing now in our country, which has caught us a little bit with the timelines. So now the EHDS, we're really trying to get to the EHDS timelines and making it before 2029. Yes, so when you really go into semantic interoperability, in 2018, there was an important report about vision about standardized terminology, where we chose SNOMED, LOINC, and IDMP as our standardized terminologies within the Netherlands. And well, this was the start to trying to implement it in our country. We chose these because they've got a broad range. It's they're international standards, and there are lots of mappings emerging available. Of course, here, as you see here at the Expo, in SNOMED, there's a lot of collaboration, between SNOMED and other terminology systems. And it covers the largest range of all this data that's registered in our healthcare system. So we had this really impactful report in 2018, and because in 2022 there was a research on how are we progressing, which turned out that it was lacking behind somewhat, and so we needed to pick up speed. I see people laughing. It's maybe a bit of an underestimate. So we saw we have to pick up speed, and then the Ministry of Health, they took the lead in this and asked NICTIS to write an SNOMED advice on implementation of SNOMED. And this was also confirmed by our Minister of Health, which made it like a resolution on SNOMED implementation, which said, of course, in the Netherlands, in 6 healthcare sectors, we're going to implement SNOMED, and we're going to implement it. We're going to start with the first steps, which are the diagnosis and the procedures. Of course, what's the basis of this advice? That's of course, it has to come from the sectors itself, because there are lots of differences between the sectors, so they know their environment, they know their process, so they should take this initiative. But we collaborate together, so that was the most important part of this advice. And of course, you cannot do it in, implement SNOMED in once, so you do it with attainable goals in the time. And complex issues, of course, you solve together, you can learn from each other, you can share your knowledge. So solving these complex issues you need to do together. And of course, from NICTIS as a competence center in interoperability, and also the National Release Center for SNOMED, we can provide help and support and tooling and education when needed. Here are 6 sectors. I want to go into those now, because what the first step that we did was we asked those sectors to write a transformation plan. So these are our 6 sectors. As you see, it's quite broad in healthcare. And we have a main body where we have the delegates from all these sectors that get together to share the knowledge. So now I want to go into, so recently, or just before the summer holidays, all these sectors have have submitted their transformation plans. And I want to tell you a little bit about those transformation plans. So they're tailored to those sectors, and they all have a phased approach in implementation of SNOMED. General content are things like governance, to involve all the important stakeholders within your field, but also, what's our situation now, and what's the impact of implementing SNOMED? Where do I want to go, and how do we get there? And very important is when you go and take a phased approach, that you think about, okay, where is the most value now? What's the low-hanging fruit? So we start with the most valuable data types, which are, of course, the problems and the diagnoses and the interventions or procedures. An important part of it is using reference sets for registration of data. So when you implement it in your system, you can implement the whole of SNOMED, but to guide it in your own process, it's better to use the reference sets for registration. And it should be inclusive. That's something that we're really looked at. Is it inclusive enough? Do we involve all the important stakeholders, such as, of course, the healthcare professionals? The policymakers are usually the one in this body of delegates. But also, do we involve the EHR providers, the software providers, and do we involve the science communities? Well, when you have 6 plans, you have a lot of variations. So what kind of variation did we see? We saw the support from within the sector, from the healthcare professionals that, will be involved in the EHR systems. there's a lot of variation in, you know, the support they have for the SNOMED implementation. Do they see the worth and the value of the implementation? Also, you see that all these sectors have a different starting point. So do they already register structurally? Do they have a legacy system of classifications or other terminology systems? And also, do you have like 1 or 3 EHR manufacturers, or do they have 40? So these are all a lot, important variations that that influence these transformation plans and also make them quite, divergent. And you can also see that in these plans. So what we do now, because, I see some issues with my slide. Well, because of course, the SNOMED implementation is not only for the sectors itself, but also for cross-domain exchange and reuse of care of data. That's why you also want them to, well, converge again. You want them to align in the implementation. So I wanted to tell you, how do we do that? First, I'll show you. These are the timelines from our national strategies and the EHDS. And if you look at those plans, the 6 plans, you see a lot of different approaches. You see parallel phases, you see consecutive phases. So you see in all these plans, they are very different and it's difficult to align them. And of course, when you want to exchange the cross over the domains, you want them to take you hope that they will take a little bit of the same timeline, the same first steps, so that you can exchange the data. So how do we do that? So how do we approach this, these divergent, the variations within the plans and harmonize them? So we're taking an approach, which is that multifaceted again. So you start at governance. So this team of delegates, we work with them to see, okay, how can we solve these complex issues and the cross-domain issues? How can we connect, for instance, the nursing care and the nurses is their healthcare professionals that are in almost all of these sectors. So how do they work together? So we try to have, pay attention to all these different connections. The reference sets, these will be made separately, but the governance, it's good to connect them. The making of these reference sets. See, what do I have? Well, the timelines, we try to connect them in time. Where does each sector take the steps? So we're writing like an overarching report where we are trying to make like a definition of done to align them within these sectors and to look at the steps that all the sectors are making and aligning them over in the timelines. And of course, something that's in the Netherlands is a big question now. Again, it's so the why. And I think it was discussed in the morning again as well in a keynote presentation, that you still have to tell, or people have to understand, why are we doing it? It's not just that we want to tease you and we say, okay, this is something it's something new we want you to implement it. No, it's important because it provides, continuity of care, patient safety, but also reduces registration time and burdens on our healthcare professionals. So that is still something we need to communicate, and we need to stay communicating, keep communicating those messages. So if someone here has any good examples on how you do that in your country, I'm really, really, would be very much, I would like to hear that. Let's see, do I have anything else? So we're trying to harmonize. So with the whole team, we're trying to get to one endpoint, to get a definition of done and work towards that together. Something it was very exciting. One of the things we do, and we really go into the field, we talk to the people. I think maybe some of you saw my colleagues, Helen de Graaf, before this, talking about the nursing classifications that we have in the Netherlands and how we are aligning those. This was a very exciting week of a design week that we did for nursing care, or you organized, and we were there as well from our National Release Center point of view. And what we did there is we took, we started at the nursing process, because that's where you need to start when you, of course, want to align the process, the terminologies. And so you start at the nursing process. So we started with, of course, on the right, you can recognize the nursing process. And we took the ISO 18104, which is a ISO standard on categorizing nursing care structurally. So we took that and we put Nanda, Niknok, and Omaha next to each other, and we took use cases to walk through them, to see, okay, what do I register here, and what code would it be? And there you could really see where also SNOMED is involved, because SNOMED is more of the language, is the words. And Nanda, Niknok, and Omaha, it's more of the thinking process. So that was really exciting and really good to see, where do you place SNOMED? You place SNOMED in your medical history, for instance, and you place the Nanda, Niknok, and Oma in, okay, this is my problem, and that's what I'm now, that's what I'm going to do with that problem. So this is my intervention or therapy. So here you can really see that they support each other. They do not clash, but they support each other. And that's also something we need to do with the other, of course, legacy systems that we have. For instance, we've got more of these, it was like ICD-10, for instance, but also with other terminologies like ICPC that's still used in general practice. So we're really working with the sectors itself to see, okay, how can we, so their systems now are all built on these classifications or terminology systems. So how do we then progress to SNOMED, but not collapse their whole system now? So how can we do that in steps, and how can it support each other? So this is one of the, a really good example of how we do that. It is a long road. And besides, working on this nationally, there's also, of course, a lot happening internationally, where, of course, we're looking at the EHDS. They're, of course, discussing semantic interoperability at the moment, and the comatology. They're deciding whether we're going to one required or multiple preferred systems, where we hope SNOMED will have a place. So we're really looking at that, so what's happening there, because we also see that not all stakeholders are inclined to move towards SNOMED, and that's more in the field than the sectors that we're working with. But some of them say, okay, there is no obligation, it's not mandated, so we're not moving until we should. But also, of course, there are a lot of exciting collaborations happening now between SNOMED and other classification or terminology systems, such as, of course, ICD-11 or Nanda, Niknok. So we're really trying to get involved there and at least see what's happening. And of course, the merging, LOINC was one of the other terminology systems that we are intending to implement within the Netherlands. So we're also really excited about the collaboration there, to make the choices of, okay, which terminology should we implement where, because of course they overlap largely. So what do I want you to take away? And I also want to take away some of your experiences if you want to share. Of course, for us, it's very important, something I want you to take away is the first thing is that we needed to approach was, what is the implementation of SNOMED? Where do we implement it? To get all the stakeholders involved that are needed, and all the healthcare sectors need to align them. So we need that initiative and that plans the bottom-up approach. The bazaar that he was talking about yesterday. So that's an important, we need them to be involved, because otherwise we won't see any movement. That this is a cross-domain effort, but there's also some guidance needed. Where are we going? Where are we going with all these sectors, because it's a cross-domain effort. So we need guidance from our Ministry of Healthcare, Welfare and Sports, but also, from us as a National Release Center. And of course, we need to keep in mind you can't do it at once, so you have to take small steps. So you eat an elephant one bite at a time. Okay, thank you.
Thank you, Marije. Great presentation, very interesting. We will now begin the question period. As a reminder, if you're in the room, please use the microphone.
And if there are no questions, I've got questions for you.
No questions? Well, then, Marije, you can ask questions.
Well, are there any people in the room? Oh, there's someone with a question.
Robert van der Stichler from Ghent. GPs have a very similar workflow in the way they do their consultations. It's based on the SOAP methodological working, subjective, objective assessment and plan. And we need to link to that, to the different items that are relevant. So very similar to what you do. And SNOMED is a huge terminology with 370,000 concepts, and our coding systems, nurses, I think, are relatively small, 1,000, 2,000. So it means that we'll have to map 300, 400 SNOMED codes to one class in our classification. So that's quite a challenge to do that right, and in respect for the classification that exists in those two professions, and in respect for the working plan they use, the way they do their encounters with the patient every day. So great approach to do this, and we do the similar things for general practice.
That's good to hear, because thank you for your comment and question, because one of our sectors, as you might have seen, are the general practitioners, and they use ICPC1. And in the Netherlands, they have, of course, the NHG tables, and their whole system is built around them. So if you just want to replace them with SNOMED, as I said, it will collapse. So what we do there is we take that phased approach again, so first map, but there will also be, so that's the first step. And after that, you can see, okay, how can we improve this? Because there's also improvement possible, and SNOMED might be, is able to provide that improvement and that, that step up. Thank you so much. Yeah. Okay, I'll ask then. So I wanted to know is, are there any people here that are also doing such a large-scale intervention and implementation within their country at the moment, or have done it recently? And what are your lessons learned? What can we take from you in our approach? Yeah.
My name is Helmut Ultinger. I'm from Austria. I'm a general practitioner. We have a very huge project. We are implementing SNOMED CT in base of all ambulant or primary health and secondary health care in Austria. These are, this will begin with 1st of January 2026. The legacy behind from the government is we had to code in ICD-10, which we didn't like. Until now, we don't have any coding system in primary and secondary healthcare. So our suggestion was just to switch to SNOMED and map to ICD-10, which is the government approved. It was a bottom-up project. This year we mapped 100,000 concepts from English to Germany with the help of the national release centers of Switzerland and Germany. And so we are very excited how it will work out. Our software firms are supporting the system. Also, it's a bottom-up project. Our colleagues don't really like coding, so our approach is a semantic way. Don't bother with coding. Give in your semantic text, and with the help of interface terminology, this is the next which you will hear from Stefan Schulz. I hope we can bridge the problem.
Yeah, thank you. Thank you for your experience. Yeah, so do you have a clear focus or a clear vision of what it will look like in the future?
The vision is to implement SNOMED CT in the whole healthcare system in Austria. Of course, hospital systems will take time. We are much faster in primary and secondary healthcare, so we will go forward. And in terms of interoperability, so like the Belgian slogan, which is very good, just code once and use every time again and don't code again and again. This is our approach too.
Yeah, for us it's eenmalige registratie, meervoudig gebruik, which is, yeah, what you said. So that's also our vision for the future and data availability. And what we found is that when we say you should implement a SNOMED for registration, that there's a lot of variation how people understand it, whether it's actually, you know, you have to build it in your EHR, you have to even type the codes, which is of course probably, it's not the idea that we had. It's something that needs to be in the back, and healthcare professionals do not need to either see it or have, yeah, problems with it. You know, they shouldn't really have to handle it, but it can help them with the text, you know, help them in registration when they find the correct text, you know, what they are finding. So that's also something that we really encountered, you know, even if you say you should implement SNOMED for registration, even that is there's a very you know, large range of understandings of what does it mean.
Our approach was, in addition to this, the government provides a central coding system, which you will implement, which you can implement by an SCPI, I don't know, to your computer systems. And so you don't have to implement it to each new system again. So we have just one central system where we can code. And this will also
UI or UX that, you know, because SNOMED is often in the background. Do you have UI or UX that you address the issue with, you know, how do we make it user-friendly?
We implement it in our systems. So if you have to record a diagnosis, you put in the semantic words, we'll get to the central system and you will get back the string.
Okay, thank you.
Okay, unfortunately, we're out of time, but you might want to continue this discussion during the lunch break. So again, thank you very much for the presentation, Marije.